Retirement homes are secretly harming millions of seniors across America, and what I'm about to tell you could save your life or the life of someone you love. But first, subscribe to this channel because the retirement industry doesn't want you to know these secrets that could protect your health and independence for years to come. The shocking truth about why retirement homes are bad for your health goes far deeper than most families realize, and by the time you finish listening to this, you'll never look at these facilities the same way again. Picture this. Martha, a vibrant 78-year-old grandmother from Ohio, was walking 3 miles every day, cooking her own meals, and volunteering at her local library when her daughter convinced her to move into what seemed like a beautiful, caring retirement community. Within just 6 months, Martha had fallen 3 times, developed a serious infection, lost 15 pounds, and couldn't remember her great-grandchildren's names. What happened to Martha isn't rare. It's the devastating norm that's destroying the health and dignity of our most vulnerable population. And the worst part is that most families have no idea it's happening until it's too late. You see, the retirement home industry has built a carefully crafted image of safety, comfort, and care, but behind those polished brochures and smiling staff photos lies a system that's fundamentally designed to prioritize profits over people, and the consequences are literally killing our seniors. Think about it. When you visit these places, everything looks perfect, doesn't it? The lobbies are spotless, the activities look engaging, and everyone seems so happy and well cared for. But what you're seeing is essentially a carefully orchestrated performance, because the real story happens behind closed doors, in the daily routines and institutional practices that slowly but systematically strip away everything that makes life worth living. The first devastating problem is something called learned helplessness, and it starts the moment a senior walks through those doors. Imagine spending 70, 80, even 90 years making your own decisions: what to eat, when to sleep, how to spend your time, who to spend it with, and then suddenly having every single aspect of your existence controlled by someone else's schedule, someone else's rules, someone else's idea of what's best for you. Within weeks, seniors who once managed their own households, careers, and families begin to lose the neural pathways associated with independence and decision-making, because the human brain operates on a use-it-or-lose-it principle, and retirement homes systematically remove almost every opportunity to use those critical cognitive functions. But here's where it gets even more sinister. The medical establishment has convinced us that this decline is normal aging, when in reality it's institutionalization trauma masquerading as natural deterioration. Dr. Sarah Chen, a geriatrician who spent 15 years working in various retirement facilities before blowing the whistle on industry practices, told me something that should terrify every family in America. I watched thousands of healthy, independent seniors transform into confused, dependent patients, not because of disease or age, but because the system literally programs them to become helpless. The second major threat lurking in these facilities is what I call the infection factory effect, and it's claiming lives at an alarming rate that most families never hear about because facilities have mastered the art of creative reporting and legal protection. Think about it logically. You're taking hundreds of elderly people with compromised immune systems and cramming them into a confined space where they share air, surfaces, dining areas, and often staff who move from room to room without adequate protection protocols. The result? Infectious diseases spread like wildfire through these communities, and seniors who might have lived healthy lives at home for years suddenly find themselves battling pneumonia, urinary tract infections, skin infections, and antibiotic-resistant superbugs that their weakened bodies simply can't fight. Remember the COVID pandemic? While the media focused on overall death statistics, they largely ignored the fact that nursing homes and assisted living facilities accounted for over 40% of all COVID deaths, despite housing less than 1% of the population. But COVID was just the tip of the iceberg. Facilities have been dealing with deadly outbreaks of flu, norovirus, MRSA, and C. diff for decades, and they've become experts at managing the legal and public relations fallout rather than actually preventing the infections in the first place. Martha's daughter never knew that her mother's sudden decline actually started with a simple urinary tract infection that went undiagnosed for weeks because overworked, undertrained staff dismissed her confusion and agitation as normal dementia symptoms. By the time they finally ran tests, the infection had spread to Martha's kidneys and bloodstream, causing the cognitive damage and physical weakness that her family attributed to natural aging. The third silent killer in retirement homes is something the industry euphemistically calls polypharmacy, but what it really means is that seniors are being turned into walking chemistry experiments, often taking 15, 20, even 30 different medications simultaneously, with no one, not the doctors, not the nurses, not the pharmacists, having a complete understanding of how all these drugs interact with each other in an aging body. Here's what happens. Mrs. Johnson enters the facility taking maybe 3 or 4 medications for her heart condition and arthritis. Within her first month, she's prescribed a sleeping pill because she can't sleep in the unfamiliar environment. Then she gets an antidepressant because she's crying about leaving her home. Then she gets medication for the nausea caused by the antidepressant. Then she gets something for the constipation caused by the other medications. Then she gets confused from the drug interactions and gets diagnosed with dementia and put on more drugs for that. Before you know it, she's taking a cocktail of medications that would challenge a team of pharmacologists to understand, and her body is slowly shutting down from the chemical overload. But here's the truly horrifying part. Every time Mrs. Johnson experiences a side effect from this medication cocktail, instead of reducing her drug load, the facility adds another medication to treat the side effect, creating an endless spiral of pharmaceutical dependency that generates enormous profits for drug companies while destroying the health of our seniors. The industry has a financial incentive to keep residents medicated into compliance because alert, questioning seniors are more difficult to manage and more expensive to care for, so they've perfected the art of chemical restraint, using drugs not to heal but to sedate and control. The fourth devastating aspect of retirement home life is the systematic destruction of purpose and meaning, which might sound less serious than infections or medication errors, but research shows it's actually one of the most deadly factors affecting seniors in institutional care. Human beings are wired for purpose. We need to feel useful, valued, and connected to something larger than ourselves, and retirement homes, despite their activity schedules and social programs, fundamentally strip away the opportunity for meaningful contribution and genuine autonomy. Think about your own life for a moment. What gets you up in the morning? Maybe it's your work, your family responsibilities, your hobbies, your community involvement, or simply the freedom to decide how to spend your day. Now imagine that all of those things are suddenly gone, replaced by scheduled activities, group meals, and entertainment designed for the lowest common denominator of cognitive function. Even seniors with sharp minds and strong bodies find themselves infantilized by systems that treat all residents as if they're incapable of making decisions or contributing value. The psychological impact is devastating because humans who lose their sense of purpose literally lose their will to live, and study after study has shown that seniors in institutional care have dramatically higher rates of depression, anxiety, and what geriatricians call failure to thrive, a clinical term that basically means giving up on life. Martha used to organize charity drives, teach Sunday school, and mentor young mothers in her community, but at the retirement home, her greatest daily decision was whether to attend bingo or watch a movie she'd already seen 10 times. The fifth hidden danger is staffing, specifically the shocking lack of qualified, consistent caregivers who actually understand the complex needs of aging adults. The retirement home industry operates on razor-thin profit margins, which means they cut costs wherever possible, and the biggest cost is always labor. What this means in practical terms is that your loved one's care is likely being provided by overworked, underpaid, undertrained staff members who might be responsible for 20, 30, or even 40 residents during a single shift. These aren't necessarily bad people. Many of them genuinely care about seniors, but they're operating in an impossible system that sets them up for failure and puts residents at risk. Imagine being a nursing assistant making barely above minimum wage, working double shifts because the facility is chronically understaffed, trying to help 30 confused, scared seniors with complex medical needs, medication schedules, and emotional trauma, all while being monitored by supervisors who care more about documentation and liability protection than actual patient care. The turnover rate in these facilities is astronomical, often exceeding 100% annually, which means that residents rarely develop trusting relationships with their caregivers and are constantly having to adjust to new faces, new personalities, and new levels of competence. But here's where it gets even more sinister. In many states, nursing assistants in retirement homes are required to have less training than the person who cuts your hair, and they're often not legally required to undergo background checks or drug testing. The person responsible for your grandmother's medications, personal care, and safety might have received just a few weeks of basic training and could have a criminal history that includes theft, assault, or drug abuse. The sixth and perhaps most insidious problem is what I call institutional gaslighting, the systematic way that retirement homes convince families that the decline they're witnessing in their loved ones is natural, inevitable, and unrelated to the care environment. When Martha's daughter expressed concern about her mother's rapid deterioration, the facility director explained that this was normal adjustment and that Martha was right where she should be for someone her age. When Martha fell repeatedly, they said her balance problems were age-related and recommended more medications. When she stopped eating and lost weight, they attributed to natural appetite changes in the elderly. At every step, the facility provided medical-sounding explanations that made the family feel like they were being unrealistic or demanding to expect better outcomes. This gaslighting serves two purposes. It protects the facility from liability and criticism, and it keeps families paying the enormous monthly fees without asking too many uncomfortable questions. The retirement home industry has become masterful at using medical terminology and age-related stereotypes to explain away what are actually preventable problems caused by institutional neglect, poor care practices, and profit-driven decision-making. They've convinced millions of families that watching their loved ones deteriorate rapidly after entering care is just the way it goes when seniors age, when in reality, many of the problems are directly caused by the environment and care practices in these facilities. The seventh warning sign that should make every family reconsider retirement home placement is the way these facilities handle medical emergencies and end-of-life care. Because what happens in those critical moments reveals everything about their true priorities and competence levels. Emergency response in retirement homes is often delayed, inadequate, or completely mishandled because staff members are not properly trained to recognize serious medical symptoms, facilities are designed more for convenience than for emergency access, and the profit-driven model means that calling 911 or sending residents to hospitals is discouraged because it creates paperwork, potential liability, and interrupts the daily routine. Martha's first fall resulted in a head injury, but instead of immediately calling paramedics, the facility waited 4 hours to see if she improved on her own because they didn't want to overreact and because emergency room visits create complications for their insurance and state inspection records. By the time Martha finally received proper medical attention, what could have been a minor concussion had developed into a serious brain injury that required weeks of hospitalization and left her with permanent cognitive damage. But here's the most heartbreaking part of this entire crisis. There are alternatives that most families never hear about because the retirement home industry has spent billions of dollars convincing us that institutional care is the only safe, responsible option for aging seniors. The truth is that with proper planning, support systems, and resources, the vast majority of seniors can age safely and happily in their own homes or in small, family-like care environments that preserve their dignity, autonomy, and health. Home care, when properly managed, allows seniors to maintain their routines, their relationships, their sense of purpose, and their connection to the community that has sustained them throughout their lives. Adult day programs can provide social interaction and professional supervision without the dangers of 24/7 institutional living. Assisted living cooperatives and small group homes can offer support with daily activities while maintaining the personal attention and individualized care that's impossible in large facilities. The key is understanding that aging in place doesn't mean aging alone or aging unsafely. It means creating support systems that adapt to changing needs while preserving everything that makes life meaningful and worth living. But the retirement home industry doesn't want you to know about these alternatives because their business model depends on fear. Fear that something terrible will happen if seniors aren't under constant professional supervision. Fear that family members can't provide adequate care. Fear that aging at home is selfish or dangerous or irresponsible. They've spent decades convincing us that loving our elderly parents means putting them in institutions, when actually the most loving thing we can do is fight to keep them connected to the lives, communities, and relationships that give them joy and purpose. So what can you do with this information? First, if you or someone you love is currently in a retirement home, you have the power to make changes. You can advocate more aggressively for individualized care, question every medication and medical decision, insist on detailed explanations for any changes in condition, and explore options for transitioning back to home-based care. Second, if you're planning for your own aging or helping aging parents make decisions, remember that retirement home placement should be the last resort, not the first option. Invest in home modifications, research home care agencies, explore adult day programs, and build support networks that can help maintain independence as long as possible. Third, get involved in changing the system by supporting legislation that improves staffing requirements, medication management protocols, and quality standards in care facilities. Because the only way this crisis will end is if families like yours demand better and refuse to accept the current standards as inevitable or acceptable. The retirement home industry is counting on your fear, your guilt, and your ignorance to keep funding a system that's failing our most vulnerable population. But you now have the knowledge and the power to make different choices. Your loved ones deserve to age with dignity, purpose, health, and joy, and that's almost never going to happen in a traditional retirement home, but it absolutely can happen with the right support, planning, and commitment to keeping them connected to everything that makes life worth living. The time to act is now, before another Martha loses her independence, her health, and her happiness to a system that profits from their decline. Subscribe to this channel for more life-saving information. Share this video with every family you know who's facing these impossible decisions. And remember that the best time to plan for healthy aging is right now, while you still have the power to choose a different path.